Hi there, good afternoon everybody. Can you hear me okay? I just wanted to thank actually the conference organisers for the opportunity to do this presentation. It's the first presentation in person for a couple of years and it's just great to be in the room with so many like-minded people and discussing these important topics. So as you can see, the title of the study is Perceptions of Gender Equity. This is a qualitative project. There is a preprint available and also a paper on the actual survey, so I'm not going to go into a huge amount of detail. But I just wanted to acknowledge my colleagues, Renita, Sarwar, Pavel, and Vasiliki and NIHR Oxford for funding the project. So some of you may be aware, Biomedical Research Centres are partnerships between NHS organisations, so the one in Oxford is part of OUH, NHS Trust and leading universities, so we're a partnership with the University of Oxford and we're funded by the NIHR, a long title again, National Institute for Health Research. And going back some years now, in 2011, Dame Sally Davis was at the time Chief Medical Officer, and she literally wrote a letter to all of the heads of medical schools saying that it was required for to apply for BRC funding, Athena SWAN Silver Award. So this is the context of the study and some of the policy. But even though there was this huge change and important structural change, we identified a gap in terms of looking at gender equity research within BRC specifically. But obviously there's a need for evidence, so that was the context to this project. So a little bit more again about Oxford BRC. We've got a website at the bottom that I just wanted to encourage you to have a look at to find out more about the research that we're doing at the moment. We're leading some initiatives alongside also my colleague Rachel, who's in the room, on diversity with patients, but also with researchers and across the whole spectrum. So you can read about that there, and also we'd like to encourage you to look at our Twitter account and tweet if you would like to. So this study was a qualitative research project. We wanted to look at not only women's but men's views on the importance of monitoring and measuring gender equity and current markers of achievement in an NIHR BRC. We wanted to create context-specific evidence to facilitate women's advancement and to help facilitate leadership progression in translational research. So I'm going to be talking today about this project, which combines, in a sense, two discrete projects: a gender equity survey, which is a larger project. There's a paper published on that specifically, whereby certain respondents provided free text comments on their views. What did they think was important? Was it important at all to even think about gender equity? And then 16 one-to-one semi-structured interviews that I completed in Oxford with women affiliated to the BRC. So this is just a very brief overview of some of the demographics of the respondents. So you can see that there's quite a broad range, particularly around investigators and researchers at all different levels, and also age group. Similarly, for the qualitative interviews, we were able to interview respondents from early career right through to professorship level, which is the first time, as far as we're aware, this has been completed in a BRC. So this is just a brief overview of some of the key findings. Just in the interest of time, I've put up a kind of summary slide of some of the key themes that we identified. So there were 4 key themes: views on Athena SWAN, views on the importance of monitoring gender equity in BRCs, views on current markers of achievement, and then recommendations. So I'm now going to just pull out some qualitative quotes just to add a little bit of flavour. But as I said, you can read more in the actual paper. So we've talked a lot about Athena SWAN, so some of the researchers said it was really important, this link between funding for BRCs was a catalyst for change. And this researcher presents a very practical example of how sometimes meetings were changed. It was taken into account. They had children, so that actually helped a lot, that had been taken into account. On the other hand, some people felt that it really was a senior leadership issue. They had to spend time on being on the committees, which was time consuming, and had taken away their time on writing grants. That was a different angle. But overall, people did say it was an important topic. It really was important to look at gender equity, particularly in a clinical academic setting where there's less visibility of women at senior level. An interesting comment, and it's been touched upon by other people today, really is about the challenge of monitoring gender equity and benchmarking. So this is just an example from a researcher who's describing or the actual practicalities of benchmarking. It's something that they didn't routinely do and something that they weren't necessarily able to do based on the complexities. Another angle that came out was that people felt it was important not only to just focus on gender, but also broader aspects of equality and diversity. So they've talked about disability, social class, ethnicity, and again, the importance of capturing this. Something that also came out that was important was around context. So currently, we've actually flowed nicely from the previous presentation talking about papers as an example of a marker of achievement. This manager talks about the importance of looking not only at numbers but context, taking into account maternity care, part-time working and caring responsibilities. Again, another example of a perception of structural barriers. So some people talked about feeling disadvantaged, applying for research grants and promotion, again, not taking into contextual account of maternity leave and this track record. And on the other hand, also interestingly, people were concerned about positive discrimination. As this researcher talks about, they didn't want to get anything just because they were female. They wanted to get it because they deserved it. Again, underlining the kind of complexity of the different issues. So things that came out of the survey also and the interviews were practical actions that they recommended. So monitoring BRC recruitment and retention by gender, seniority of staff and their job roles to explore retention and recruitment processes. They also wanted to ensure that there were organisational policies that could catalyse change. So this researcher here talks about having processes that actually remove the bias and honour achievement. So this has been a whistle-stop tour just in terms of the timing today, but this has been one of the first studies, as far as we know, to explore both women and men's views on markers of achievement for women in academic settings, specifically BRCs. Previous research in this field has focused mainly on Athena SWAN initiatives, which are based in universities, whereas this project has a broader remit. We also find that markers of achievement should take into account contextual factors, such as career progression and professional advancement. But also the findings suggest that the markers should be complemented with broader aspects of equality, diversity and inclusion. Thank you very much.